a material, a material, a material world.
In a material world. Living 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 in a material world.
Hey, it's 8:30. Good morning, everybody. I was just playing Material Girl from Madonna, and we got a couple of Material Girls here, I do believe. Tammy's here, and Jennifer's here, and we're going to talk about something I don't know much about today, which is easy to understand, right? Happens all the
It could
time.
be a variety of subjects.
Many subjects
Yes.
we could venture upon here, but this is going to be aquatic therapy, right?
That is correct.
Yes.
All right, well, Jennifer, she's the one that does it. Tammy, why are you here?
I'm just support.
All right, very good. Support girl. You wanted to tell Matt something, right?
Hey,
Uh-oh.
Hey, we butcher our own meat too.
Oh, do you?
So yeah,
very
we,
good.
do all that at our house.
Very good.
Fun
Yeah,
time.
nothing better than home-raised beef
That's right.
or pork or
We did
whatever
beef
you got
last
going.
night.
Yeah. Oh, last night. Just,
Uh-huh.
I mean, yeah.
Yeah. You took
Very
a bath
good.
after that, right?
No,
No,
Nope,
just
just came right
I'm fresh this morning.
Okay. Well, Tammy, after this, we know what you need to go do. But anyway,
Uh-huh.
but it is great, and it's very nice to have Jennifer here. Her first time talking about what she does, aquatic therapy. Tell us a little bit about yourself and how you got involved in that. That's an interesting thing.
Well, so I got my PTA license and I started out working PRN, and then I also worked in an outpatient clinic that had a small pool. Then for a few years I worked in a nursing home, and then I eventually got to St. Anthony's, and the aquatic position was open, and I started treating patients in the pool there.
Were you always drawn to water? And that kind of therapy. I'm just curious about that.
I really enjoyed it when I worked in the outpatient clinic here in Effingham initially, and when the position was open at St. Anthony's, I was definitely ready to jump at that.
You
and
jumped right in the pool.
I did, basically, yeah.
Very nice. Well, that's neat that you got into something, and you can tell that you like this because you really, I think you really enjoy it, don't you?
I do, yes.
And what was it's very interesting. You know, you always hear about exercising in the water and stuff is like maybe healthier for you. Is that really true?
It is, yes. There's a lot of benefits to working in the water. You can the gravitational pull is a lot less than what it would be on land. So a lot of patients can do exercises in the pool that they're not able to do on land, or that causes them pain. So that's a much better environment for some of our patients, especially our elderly patients that have, fears of falling or things like that. They can get in the pool, and if they fall, well, they splash.
It's not so bad.
Right.
I guess it's easier on your joints and stuff if you're working out, and I could see where that would be a very helpful thing.
Yes, it is.
All right. Is it required to have a certification to be able to treat a patient in the water, or do they just let anybody do it?
Well, so you don't necessarily have to have a certification to treat patients in the water, but here at St. Anthony's, I went, they allowed me to go 3 years ago in 2018 to get my certification. I took some courses, had to sit for an exam with the Aquatic Therapy Rehab Institute, and got my certification to be able to effectively treat our patients. So it's a benefit of coming to St. Anthony's because there's not a certified aquatic therapist south of Champaign.
Oh, no kidding.
Right.
So,
So-
you're a rare breed.
Yes,
Do you
very
know-
much so.
Do you know how to swim?
I do, yes.
Thought I'd
Sometimes.
ask. That's what I'd
Sometimes.
ask. All right, very good.
Well, let's just say some guy maybe rolls his ankle
Oh,
a
yeah.
few days ago.
Maybe.
And then maybe stepped on a nail with the other foot just a couple days ago.
Asking for a friend.
Oh yeah, asking for a friend. Is there anything that you could do that would benefit them? Is that the kind of people you're looking for, or what are you able to treat?
I could treat that as long as, stepping on that nail once that spot closes.
Yeah, heals up.
You
Yeah.
definitely don't want to have an open wound getting in the pool unless you can cover that with a bandage that's, aqua safe. So, and they do make those. So
Okay.
you can get in the pool with a wound if needed. If it's small enough, we can use a bandage to put on that to let you get in the pool.
Very interesting. Yeah, he did twist his ankle pretty bad the other day. So, how would you go about treating somebody with a twisted ankle or like something like that?
We would do a lot of walking in the water, just making sure that we're strengthening those muscles of the ankle. There's a lot of equipment that I can use to treat a patient in the pool. I can use the effects of the water, but then I can also use certain pieces of equipment. I have bands and lots of different things. We also have the lazy river that we can use for more resistance if we need to.
You got the inner tube and a place, to hold your beer and stuff.
Well, I don't know about
Like on
that,
vacation?
but some of my patients do get pretty relaxed, especially those that are in pain. I do a
bet
lot
so.
with those. So
I bet that is a nice thing. I never thought about that.
Yeah.
That's pretty cool. Very cool.
How deep's the water?
Yeah.
So the most shallow point is 3'6", and the deepest that it gets is 4'6".
Okay.
We have a zero entry, so you can walk down
Just
the
walk
ramp.
right in there.
Yep, and then we also have steps with 2 handrails, and we also have a chairlift for those patients. I've treated some quadriplegics in the
Oh,
pool,
yeah.
and we just use a chairlift to get them in. So
Very nice.
yeah.
I think this is probably a pretty rewarding thing to see somebody. I think some people would get better pretty quickly on some of their injuries they have.
Yes, it's a great place to work. I've seen people walk for the first time in the pool, and it's pretty amazing.
That has to be pretty neat, no doubt. I like this one question. Do you have to be able to swim if you go for aquatic therapy?
No, you do not. Again, like I said, the pool depth is the deepest at 4'6". I get in with any patient that has a fear of being in the water. Having a phobia is one of the things that kind of makes me nervous with patients because I'm always afraid I'm not going to get the outcomes that I want to get.
Sure.
But it's definitely not a total hard no if they have a phobia of water. I have had some patients that are afraid to get in the water that we've worked with. We've worked and they were able to actually be able to get in and now they come on their own. And when they told me initially, I wasn't going to do this because I'm afraid of water.
Yeah.
But now they come on their own and they do their own thing after I was done treating them. So
very neat.
Yeah.
That's very cool. So, no matter who you are, if what are the main injuries you can treat? What are you looking for?
So I do a lot of different, generalized weakness with the elderly or anybody that's had a surgery as long as their incision is healed.
Mm-hmm.
I do a lot of joint replacements, knees, hips, things like that, balance deficits, orthopedic injuries, things like that, prenatal conditions.
Okay.
I can treat some things in the pool for that, like back pain, circulatory issues, swelling. Anybody that has swelling, the pool has great beneficial pieces to being able to help with that.
How does that work out? I was curious if you got like what of doing the aquatic therapy, just getting the exercise and working it out, or?
So the properties of the water, the hydrostatic pressure, that pressure on the skin helps to give a little bit of compression.
Sure.
And so it helps to alleviate that. I also work in conjunction with OT, with lymphedema therapy. So they'll come and they'll get in the pool and work with me. And then they'll go over to lymphedema and get their wrapping done. So
That's very
it's
interesting.
kind of a twofer
Very
on that.
neat.
So
All right, so a lot of people out there thinking, yeah, I could probably use that, and who wouldn't want to take a dip in the pool? And anyway, it'd be a fun time and maybe an easier way to get you healthier. How's the best way to get in touch with you guys and get it started?
So our phone number is 217-347-1243. The best thing is you can get a aquatic therapy order from your doc and have them send it over to us, and we'll do a land evaluation for the aquatic therapy. It always starts with land. The goals are land-based, and then I will tweak them to what I need to do in the pool to be able to achieve those goals on land.
It's pretty cool. Have you seen a lot of growth in this area? A lot of people are taking part in this?
Yeah, we really have built up the clientele that we get and the patient, we've gotten a lot more and would like to see even more.
Sure. Tammy, it's going okay, isn't it?
It's going amazing. So when Jen came on with the aquatic therapy, we knew that it was going to be a home run just because it's a service in our county that we didn't have before.
Mm-hmm.
And we've been located in the Richard Workman Complex now for probably 4 years, I think.
Sounds about
And
like
when
right.
we started, we did not really have a whole lot of aquatic therapy per se. So when Jen came on board, she got certified. We started talking about it more. She works in conjunction with the other physical therapists. So patients sometimes will go back and forth between land, aquatic,
Okay.
aquatic, depending on how they're, how they're feeling, how they're healing, and so forth. And Jen's done a phenomenal job. It is, I think, the most rewarding one I've ever seen is we've seen stroke patients come in, and seeing them walk
Oh, wow.
is just the most amazing thing that you would ever see.
It's a good way to get started on that, and then hopefully move out of the pool and they can walk on their own.
Exactly. That's the goal.
Very nice. Well, nice to meet you, and Tammy, come by anytime. You'll be back soon, probably.
Tuesday.
All right, very good. Well, very nice. Well, it's nice to see you, and keep doing the good work, okay?
Thank you.
All right.
All right, time to move on to community calendar on this Thursday after a nice visit there with the aquatic therapy.